Johnson, and we have Luis here with us this morning. And Luis drove all the way down here from Dallas, Texas to see us here in Houston because he had already been to a chiropractor who tried to sell him on a series of 12 sessions on a DRX 9000 spinal decompression machine, right?
Yeah.
After you filled out just a couple of questionnaires, he said, "Oh, you're a candidate."
Yes.
For
Pretty much told me that.
For $4,000.
$4,000. Yes.
Yep. Well, what we do here is manual spinal decompression, which achieves, I think, a lot better results than the machines themselves. I think those DRX 9000s and traction machines are basically that, glorified traction machines. And so we're going to show Luis what a real spinal decompression feels like. Let's have you relax your arms there. Now I'm going to have you flex your head forward and then backwards. And then neutral. Take a deep breath in. Let all of your air out and relax. Now see, right now I'm analyzing his posture on the X, Y, and Z axes. Now y'all be happy to know that Luis's neck has gone to the left of center today, not just the right. And his head's also way forward. So see how your ear's out here, Luis? In front of your clavicle? That's what's making your shoulders round forward a little bit.
Okay.
And then down here, if you look in the mirror, you have a little more room over here. No, don't move your arms. You have more room here than you have on this side. Do you see that?
Yes.
So your pelvis has translated to the left of center. Your head's forward to the left and tilted off to the left.
Okay.
So we've already done Luis's examination, orthopedic neurological examination, and I am treating him as if he has a herniated lumbar disc in the L4, L5 area, because he does have bilateral radiculopathy going down his legs all the way into his feet. And I did all the orthopedic neurological tests on him, which were all within normal limits. So I feel very confident in adjusting him with this today. So let's go ahead and lay you on your back here. Okay. Now we're going to scoot you down this way just a little bit, Luis. Now because of his consultation and examination, I have determined that his main problem is in his bilateral sacroiliac joints. His leg's about a half an inch shorter on the right compared to the left, and when I bring it up it gets longer, so that tells me it's coming from his SI joints. That's a positive Knockless and Deerfield test. His reflexes are a little bit low on the left side compared to the right. Just relax those right there, Luis. I'm going to have you keep your teeth together. Take a breath through your nose. Let it all the way out. There you go. Now, you should have felt that all the way down, Luis. Did you?
Yes.
Okay, keep breathing. Breathe through your nose and out your mouth. See, he's still kicking. Okay. Just relax your head right in my hand. He's also had some neck pain and headaches. There we go. Good. So after we get done with all this treatment today, we'll ask Luis if this is worth his drive down to Houston from Dallas for this. Okay, let's come over here on your tummy now, Luis. Let me help you up. There we go. Gosh, I guess I should start charging $4,000 for 12 sessions of doing that. Okay. Yeah, his legs are exactly even now just from doing the spinal decompression on him. And they stay even. I bet you that's not as tight as it was a while ago.
Not at all.
Yep. So I am going to adjust your SI joints here, Luis. I'm going to start off with the right one because that's the leg that was short. And then I'm going to get the sacrum right in the center of your pelvis. Left SI joint. And then I'm going to come back to the sacrum on the left-hand part of the sacrum and then the right part of the sacrum. Now moving up to L5, straight P to A on the Z axis, L4, L3, L2, all the way up to L1. You notice how the angles on my arms changed. Okay. There we go. Just keep breathing. Don't hold your breath. There you go. Yes, sir. Crack addicts are going to love you. Okay. Legs are exactly even, and you shouldn't have any pain or tightness in your low back at all, do you?
No.
Okay. So see, we've got that lined up already. Now slide down this way just a little bit for me. I'm going to put the curve back in your cervical spine here too. He has a loss of his normal cervical lordosis. There we go. Okay, let's turn you on your back now. Okay, put your hands right there on your tummy. Made you break a sweat, huh? There. That's the autonomic nervous system functioning. Good. Now slide down this way about an inch, Luis. And put your arms straight out to the sides for me, please, sir. Straight out to the sides, like this. Palms up. I'm going to adjust your shoulders, your clavicles where they attach to the sternum, into your rib cage. There we go. Good. Okay, just relax your hands on your tummy. And let your leg relax in my hand. There you go. You should have felt that in your knee all the way up to your low back.
Yeah.
Did you?
Yeah, I did.
Okay. There we go. You feel that one in your knee all the way up to your low back?
Yes.
Okay, let's sit you up and face this way for me. Yeah, you're already breathing easier. Okay. There we go. That's your right shoulder. Keep your chin up. That's the most common mistake most patients make, is they let their heads drop down all the time. You want to start keeping your head up. So you let it drop down again already. There you go. Being cognizant of this stuff, though, will help your low back get well quicker. And I'm going to show you an exercise here in just a second that'll help that too. There you go. Very good. Okay, let's come over here and stand in front of the mirror. And I'm going to have you close your eyes again, Luis, and bend your head forward and backwards. And remember how this feels. Should already feel a little bit smoother. Yeah. Okay, take a look in the mirror. So you're still a little bit forward, but you're not as far left. So let's pull these up and back. Hold those there for me. Flare these guys way back like this. See how that tightens your whole trap up? Mm-hmm. And then we bring the head straight back on the Z-axis. Because you're a little bit left, we're going to go right. Now shift your pelvis straight right, like this. Way out to the side. Yep, look up at the ceiling. Keep your pelvis shifted way right. Okay, you're going to feel a little tap right here. Good, now relax. Now flex your head forward and backwards. Just your head, forward and backwards, all the way. Okay, now stand up at neutral. Take a look in the mirror now. Joseph, can you move over to the side just a little bit? Better. Yeah. See how that widened the space? Your shoulders are level now and your head's not cocked over to the left anymore. So Luis, would you mind sharing with our YouTube subscribers, was the examination and consultation that I did on you here before we started even treating you more comprehensive than what you got?
Yeah. I mean, well, before you explained what the treatment was going to be about, and then versus what I went and I was about to pay for another treatment. It's a big difference.
So this was a lot less than $4,000 for you today, right?
A lot less.
Yeah.
Yeah.
Yeah. And how do you feel right now?
Well, I feel it's different. I mean, I don't feel as tight as I felt
When you walked in?
When I walked in, yeah.
Mm-hmm. Do you
Yeah.
still have the same amount of leg pain or weakness?
No,
Great.
no.
That's your first visit.
It feels great. Yeah, it's first visit.
Very
So,
good. And you'll be coming back to Houston for more.
Yes.
Very
yes,
good.
I will.
So this your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief in Houston, Texas with Luis, and we'll see y'all soon.
Thank you.